Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So, in this presentation, we will discussing about the ROODS approach. So, first is the introduction. So, ROODS approach is developed by the Margaret Rood in 1976, and ROODS approach is used in PT, that is physiotherapy, as well as in OT, occupational therapy. ROODS approach is mainly used in the neurological patients such as CP child, that is cerebral palsies, and patient with motor control problems. Next are the principles of ROODS approach. First is controlled use of sensory stimulus, in which first is specific motor response, second is normalization of muscle tone. Second principle ROOD approach is use of developmental sequences, that is sensoro-motor development, that is from lower to higher levels. Third principle is use of activity to demand a purposeful response. Fourth is practice of sensory motor response is necessary for motor learning. Next are the rules of sensory input. First is a fast brief stimulus produces a large synchronous motor output. Uses stimulus confirm the reflex are functioning. Second, a fast repetitive sensory input produces a maintained response. Third is a maintained sensory input produces a maintained response, for example gravity or position. Fourth is slow rhythmical repetitive sensory input deactivates body and mind, for example slow rocking or soft music. Next are the sequences of motor development, in which first is reciprocal inhibition and innervation. Early mobility pattern protective is nature. Phasic and reciprocal type of movement is occur in this phase. Contraction of agonist and relaxation of antagonist in the reciprocal inhibition and innervation sequence of this motor development. Second sequence is co-contraction, that is tonic or static pattern, stimulateness, agonist and antagonist contraction. Third is the heavy work. It is a controlled mobility pattern, Stoke-Meyer, that is mobility superimposed on stability. In this proximal muscle contract and move and the distal segment is fixed, for example creeping. Fourth is skill, highest level of motor control, combined pattern, proximal segments are stabilized and distal segments move freely, for example typing. Thank you.